mind leading us in the pledge?
Sure.
Pledge allegiance to the United States of America and to one nation, under God, indivisible, with liberty and justice for all.
Thank you. Announcement of the interpreter, please.
Buenos días, mi nombre es María y estoy aquí para los servicios de intérprete en español.
Additions or corrections to the Board of Supervisors of the Monterey County Water Resource Agency?
There are no additions and corrections for this agenda.
Great. It looks like we have 3 items on today's consent calendar. So if are there any members who would like to pull an item from this agenda? Hearing none, I'll take it to the public. Is there a member of the public who'd like to pull items from this agenda?
Okay.
Seeing none, I'll bring it back to the board for a motion.
Consent.
Second.
Motion by Alejo and a second by Parker. Roll call vote.
Supervisor Alejo?
Aye.
Supervisor Phillips?
Aye.
Supervisor Parker?
Aye.
Supervisor Adams?
Aye.
And Chair Supervisor Lopez.
Aye. We're going to call to order the Board of Directors of the Pajaro County Sanitation District. And as we do that, I'm going to just remind folks that if you'd like to make a public comment today, there's a couple options. Obviously, we have room here in the chambers for those here that'd like to come up to the mic. If you're participating via Zoom, you can, in the Participants tab, raise your hand using the function at the bottom of that tab. Or if you're participating by phone and would like to be recognized by punching *9, it'll let us know that your hand is raised and we will recognize you and give you the time to speak. I'll repeat this announcement a few times during the meeting to make sure those that join later also know they have that opportunity. So now we're going to, again, call to order the Board of Directors of the Pajaro County Sanitation District. Roll call, please.
Good morning. Let the record reflect Director Parker, Director Alejo, Director Phillips, and Director Adams are appearing via video conference, and Chair Director Lopez is appearing in person.
Any additions or corrections to the Pajaro County Sanitation District agenda?
There are no additions and corrections.
Thank you. Looking at consent, we have one item. Is there a member who'd like to pull this item? Seeing no hands going up, I'll take it out to the public. Is there any member of the public who'd like to comment on this item on consent? Seeing none, I'll bring it back to this board for action.
Consent.
Second.
I have one second from Phillips. Roll call vote, please.
Director Alejo?
Aye.
Director Phillips?
Aye.
Director Parker?
Aye.
Director Adams?
Aye.
And Chair Director Lopez.
Aye. Motion carries. Thank you. We'll adjourn the Board of Directors of the Pajaro County Sanitation District and reconvene on public items on the Monterey County Board of Supervisors agenda. Roll call, please.
Let the record reflect Supervisor Alejo, Supervisor Phillips, Supervisor Parker, and Supervisor Adams are appearing via video conference, and Supervisor Lopez is appearing in person.
Additions or corrections, Madam Clerk?
There are additions and corrections to this agenda. On the consent calendar for the Health Department, a revised ordinance was received for item number 15.1. And for the consent on general government, item number 21 will be pulled off the consent calendar at the request of the Human Resources Department.
Thank you. Mr. Gerard.
Thank you very much, Honorable Chair and members of the board. Just a quick comment on the revision to the ordinance under item 15.1. This was an ordinance, an urgency ordinance in response to referral 2020.19, suspending the requirement to charge for reusable bags at the various retail outlets in Monterey County. The governor suspended the applicable portions of the Public Resources Code until June 21st, 2020. Originally, the ordinance mirrored that hard end date. However, a member of Supervisor Adams' staff had a very good suggestion to just refer to such other date as the governor may choose to suspend the provisions of the Public Resources Code in case he extends it beyond June 21st. That way we don't have to keep coming back to the board. So that has been added to the ordinance.
Thank you, Mr. Gerard. We appreciate that addition. So if we have that addition to 15.1 or correction and the pulling of 21, is there any public comment on the change to the agenda? Seeing nobody coming forward, do I have anybody via Zoom? Seeing no it's going up, I'm going to bring it back to this board.
Move consent with those changes, Mr. Chair.
Got a motion from Alejo.
Excuse me, Mr. Chair, we're not moving consent. We're just adding, we're just making these changes.
Correct.
Great. In that case,
got a motion
I'll
to
second
make
the
the
motion.
change. Second by Parker. Can we get a roll call vote, please?
Supervisor Alejo,
Aye.
Supervisor Phillips,
Aye.
Supervisor Parker,
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Thank you so much. So now we're going to head into the consent calendar, and I'll ask members of the board if there's any items they'd like to have pulled. Supervisor Parker.
Thank you, Mr. Chair. I'd like to pull 27 for comment.
Any other items to be pulled? See no hands going up, I'll ask the public, is there an item they would like to pull to be spoken on? Seeing nobody coming forward and no hands going up via the Zoom, we will go ahead and let Supervisor Parker talk to 27.
Thank you, Mr. Chair. And by the way, the sound from your microphone and to a slightly lesser extent, County Council's microphone is extremely low. So I'm wondering if the clerk can turn up the volume. Looks like you're close enough, but we really have to strain to hear. It's worth it, but it may be true for the public as well. So on number 27, I just wanted to say this is the special districts. And I just want to thank RMA staff. Over the last several years, I've been asking that we really do a thorough look at the special districts, the CSAs, to make sure that they are sustainable in terms of the amount of money that's coming into their budgets for the responsibilities that they have. Many of them, when they were set up, had no sort of inflation index or anything else. And so this report, just when you read it, you see that the staff really has set out a very clear and organized path to assess all the issues related to those districts. And I just wanted to thank the staff very much for getting us on this track and moving it along. Thank you.
Thank you, Supervisor Parker. Any other comments from board members on this item? Any comments from the public on this item? Seeing nobody coming forward and no hands going up via the Zoom, I'll bring it back to the board to move the consent calendar.
So move.
Got a motion from Parker. Is there a second?
Second.
Got
Adams.
a second from Adams. Thank
Second.
you. Roll call vote, please.
Supervisor Alejo,
Supervisor Alejo, you're muted. We didn't get your vote. Still muted.
Hello?
there you
Can
go.
we get your vote?
Yes, aye.
Thank you.
Supervisor Phillips,
Aye.
Supervisor Parker,
You only
Aye.
have to vote once.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Thank you. The consent calendar carries, and we'll roll forward into appointments. There are 2 appointments on today's calendar. Is there a member of the public who'd like to speak to appointments? Seeing nobody coming forward, seeing no hands going up via the Zoom, I'll bring it back to this board to see if there's any conversation or if anybody would like to put forward a motion.
So moved.
Got a motion from Adams and a second from Alejo. Roll call vote, please.
Supervisor Alejo,
Aye.
Supervisor Phillips,
Supervisor Phillips, can you vote again, please?
Aye.
Thank you.
Supervisor Parker,
Aye.
Supervisor Adams,
Aye.
and Chair Supervisor Lopez.
Aye. Thank you. We're going to go ahead and consider that approved and move into board comments. I'm going to go in reverse order this time. Supervisor Adams. You're on mute.
Thank you very much. I am not now, but thank you very much. Thanks to everybody that's just doing such yeoman's work on this entire situation that we find ourselves in. I specifically, though, want to thank the residents from District 5 who participated in the virtual fireside chat that we had last week, and specifically wish to thank the county staff, excellent staff, Nick Chulos and Dr. Marino for being panelists, as well as the President and CEO of United Way, Katie Castagna. They provided information that was really important to the public about resources that are available to help everyone who's struggling during this difficult time, as well as the many concerns about the shelter-in-place order and the alternate care and housing sites. I feel like the entire meeting was a very supportive and helpful one. We received more than 100 questions ahead of the meeting, and as well as more of them during the meeting. So we weren't able to get to all of them during the Zoom webinar, but we're making every attempt to answer the questions that people had put forward. And then finally, I want to acknowledge that Sunday is Mother's Day. And for some mothers, it's the very first Mother's Day they'll ever have. And for others, it's the last Mother's Day that they'll ever have. But for all of the women in our community and the men who function as mothers in their households, I really wish just a special thank you. The work that you're doing is the most important work in the world. Your actions shape the future of our nation and our world. And I want to just reach out and let you know how much all of us appreciate the work that you do tirelessly, day in and day out. So here's to all the moms in ever. Thanks.
Thank you, Supervisor Adams. Supervisor Parker.
Thank you, Mr. Chair. Just want to express my appreciation to all the members of our community who are complying regardless of how difficult it makes their lives, are complying with the shelter-in-place order. It really is helping us be successful in minimizing the transmission of the virus. And want to also thank the mayors in my district. We had another of our weekly meetings with the mayors. They are really great partners with us in communicating back and forth between the community and the decision makers. So, and then in addition, last evening, our weekly virtual hot topics, we had as our guest Dana Edgel from the Monterey County Health Department Behavioral Health Division, who really walked through the resources available through the Forward Together program that really supports us in keeping our mental health in the healthy range with the stresses and challenges of this unusual time that we're in. So thanks to everyone for the great work you're doing.
Thank you, Supervisor. Supervisor Phillips.
Yeah, I too want to thank everybody for doing their part. You see people abiding by the social distancing, and you see people wearing the face masks, and so I think that's really critical. It's nice seeing some of our industries and our community going back to work. It's you just get the feeling that there's so much more positive feeling the community as people going back to work, and we look forward to working with Dr. Marino and as we hear more from the governor's office about what other segments of our community can get back on track. So I appreciate everybody's constant work and dedication to making us safer. Thank you.
Thank you, Supervisor. Supervisor Alejo.
Thank you, Mr. Chair. I also want to give a shout out to all our mothers and grandmothers during this upcoming Mother's Day celebrations. It's going to be a very different one, but hopefully many of our families could organize Zoom conferences with their families close and afar to honor the mothers and grandmothers who have really are the backbone of our families and that bring us all together. But I want to really acknowledge them because many times they're the ones during this crisis giving people comfort and encouragement and uplifting spirit. So our Monterey County is very thankful of all our mothers throughout our county. I did also want to express my concern and alarm about the disparities in the number of COVID positive cases coming out of East Salinas and North Salinas. I think it's a disproportionate number, but it's a reminder that as a county, we have to work harder and deploy more resources where we know there's greater numbers of cases that are coming out. I am glad that starting on Wednesday, just as in Greenfield, there will be more testing out of Alisal High School to be able to hopefully test and be able to identify persons in our community who are COVID positive, but maybe asymptomatic or pre-symptomatic. But when you look at the demographics of those zip codes, you really see that they're really working class, poor families, sometimes living in a high density or overcrowded conditions, or both. Many times there are higher numbers of essential workers working in these neighborhoods. So I just wanted to acknowledge that it is a concern of mine, and that we'll be, and as county staff and as a board, to continue to work to make sure that we're doing all we can to prevent the spread in these particular hotspots in our county. And lastly, I just wanted to get on a positive note, just wanted to acknowledge and thank all those people who are going out to our agricultural fields to acknowledge all our farm workers. It has made national headlines, but from the organizations to the individuals and families who have expressed gratitude and honor and a concern for their protection, I think it reflects good on all of us, not only in Monterey County, but even in the Pajaro Valley, that includes Santa Cruz County. There's been an outpouring of community support, and I think that's a testament to how we're supporting each other during this time, and caring for everyone in our county. So hats off to those people who have really shined by that expression of gratitude. Thank you, Mr. Chair.
Thank you, Supervisor Alejo. You know, my wife doesn't watch these meetings because she hears enough from me at home. And Mother's Day is coming up, and it's going to be her first Mother's Day. So if anybody has ideas, I'm a little freaked out. Send them this way. But happy Mother's Day to all the mothers out there, really. I know it's going to be a unique one for several reasons, but it doesn't mean we appreciate you or love you any less. So happy Mother's Day. Thank you to our residents. You know, I want to share that the way I see things moving lately, we went to a mask order. We went to stepping up testing with 132 tests being done a day out of Greenfield and Alisal High here in the coming few days. And with that came a shelter-in-place order that lifted some of the restrictions. Those three pieces work together. They work together to keep our community safe and to make sure that we're doing everything we can to battle COVID. That's our side. But the reason that it's worked so far is because the community has stepped up, because they've kept social distance, and because they've made sure to keep themselves and their neighbors safe, and they deserve that recognition as well. So thank you. Thank you for taking this seriously. Thank you for protecting one another, and thank you for doing everything you can to help us slow down the spread of COVID-19, to keep our first responders and nurses and firefighters and EMTs and ambulance drivers safe. We greatly appreciate every one of your efforts. Everything you do helps, so thank you. I did want to just share that through this process, we're learning as well. You know, the last pandemic that our country truly faced, I think, was probably the Spanish flu in 1919. And so this isn't easy, but we're doing our best, and we're trying hard every day to improve. Just like any other day, there's a lot of public employees who got into the field because they're passionate about serving the public, and that's the reason we're all here. From the members of the Board of Supervisors to, you know, folks like Dr. Moreno, our nurses, and all those that come to work every single day to take care of every one of us and to make sure that life's a little better here on the Central Coast because of the work that they do. We say thank you. So those are my comments for the day, and I'm going to turn it over to our CAO for any comments or referrals.
Thank you, Mr. Chair. I appreciate the comments from all the board members. As you mentioned, we have eased some of the restrictions, and we want to make sure that with those easing of restrictions, people remain following the health order from Dr. Moreno so that we can keep easing of restrictions. It's great to see that the golf courses are reopening and that construction is happening and landscapers and gardeners are out. And we want to keep those people working and keep everybody working in our county that have the ability to go out there and work now. And we look forward to a continued easing of restrictions. So the more we can keep the virus at bay, the more likely we're going to be able to ease those restrictions as we move forward. With that, we're going to take the lead of the governor and seeing that he's looking at phase 2 coming up. Which should enable us to look at some of the local industries and individual businesses that we may not have been aware of yet, but we're going to look at those to see if they're appropriate for reopening, and obviously following the advice of our healthcare professionals. With that, I'll turn to the referrals. We have 3 new referrals this week. 2 of them are related to COVID-19. First from Supervisor Parker would be to direct the County Administrative Office to increase the capacity for external communications about COVID-19 with the residents. And we look forward to building up the capacity that we have. Appreciate that referral from Supervisor Parker, and we are moving forward with that referral already, and we will get some reports back to you on that. The second referral from Supervisor Parker, is to get a presentation for the board on a weekly basis on the status report of all the efforts that we're making to address COVID-19, particularly through the health department, of course, and how we're going to meet the 6 indicators listed by the governor's office on modifying the stay-at-home order as we move forward. And we will work with staff to bring that forward. And then finally, as you had with your addition to your consent calendar read by County Council, is to address the temporary suspension of the carryout bag ordinance and the fees associated therewith. And that is moving forward as we speak. So thank you, Mr. Chair.
Thank you, Mr. CEO. And if I could I want to elaborate on that last one. The reason that was done was because, yes, the governor suspended the state's requirement on that, but we also had a local one layered over the top of it. So I wanted to make sure we address that, as we did have some stores charging and others not. So it puts us all on an equal playing field. Thank you so much. And thank you to Supervisor Adams for taking on that referral with me. I appreciate that. We're going to head into general public comments at this point, and each speaker will have 2 minutes to address this board on items not on today's agenda. And now would be the time. I'm going to go ahead and go to the public in the room, see if there's any comments. Seeing none, we'll go to the Zoom. Again, if you're on Zoom and you'd like to make a public comment, the way to do that is to hit raise hand in the participants tab. Again, raise hand in the participants tab. If you're on a landline and would like to do the same, you would enable that function by hitting *9. That'll let us know you'd like to be recognized. And it looks like...
Supervisor, we have an email. Someone's emailed the public comment.
Thank you. Please go ahead and read that in.
So this is from Brad Anderson. Dear Supervisors, please be advised that my past family involvement and current contact with friends in and around the county of Monterey, plus my years of living in nearby communities, has emboldened my advocacy for my friends that are affected in the actions of the organization of the Northern Salinas Valley Mosquito Abatement District. Please retain my statements on record and possibly investigate my concerns that are listed in this letter. I have contacted the NSVMAD in the past with regards to their past mosquito treatments and their YouTube videos. My intention was to potentially save them for potential litigation from performing unsafe and illegal activities on their YouTube channel. Please. Plus, I request that the NSVMAD district manager, Mr. Ken Clem, avoid using district properties drone as a toy in an unsafe, careless matter for Facebook posting during this time of mass unemployment and uncertainty in the future for many Americans. And of course, the massive amount of public collected resources that are being funneled into the new building and the property for the NSVMAD that will damage the budget and will possibly lessen vector control services this coming year for the already overtaxed community. But one of the most unnerving encounters was my request to the Northern Salinas Valley Mosquitoes Abatement District for a contact email address for their clerks of the board and information on their yet-to-be-released public meeting agenda. They have been for months behind on releasing public notices. The response was direct and unprofessional by the NSVMAD district director. He wrote, "You are not a constituent, and you are wasting our time. Please watch the special district, and please do not accept the notion of mosquito season, or that viruses are common and should be expected, and your county continues to have disease will only illustrate that the NSVMAD are not performing their duties."
Thank you, Mr. Lorenzano. We appreciate that. Again, I see no hands up via the Zoom. I'll confirm that with the clerk. Right? Okay. Oh, I've got one, Victor Longoria. We're going to go ahead and unmute you and give you 2 minutes now to share your comments with this board.
Hi, thank you for having me. I just had a question regarding line item 21. I was wondering if you can provide me an explanation as to why it was pulled from the agenda today.
Is that the extent of your comment, Mr. Longoria?
Yes, I would like to see it actually take part in today's agenda so that we can discuss it.
It's already been pulled, but I will have staff come up and give us just a quick response. I believe they might reach out to you directly, but I'm going to ask Irma Bao to come forward and address that. Thank you for your comment.
Thank you.
Good morning, Chair and board members. In response to your question, Mr. Longoria, I will be giving you a call as soon as I go upstairs to address any questions that you may have.
Thank you. Any other members of the public? I see a hand up by Sarah Bowe. We're going to go ahead and go to you, Sarah, for 2 minutes. If you unmute your microphone, you should be able to share your comments with us. Ms. Bowe? Okay, we can't hear you, so I'm going to go ahead and move on to John Baker. If we could unmute Mr. John Baker and give him 2 minutes to share his comments.
Good morning, Supervisors. My name is John Baker, liaison for the California Utilities Commission for Monterey County. I just wanted to make sure that constituents who are listening know that in the short term, our CARE program, California Alternative Rates for Energy, has been expanded and is temporarily holding off on verification checks. I know that a lot of your constituents are temporarily without work and be nervous about their ability to qualify for the program. Temporary unemployment is a cause for enrollment. So I just want to make sure that your constituents know that they can save some money on their utilities by applying with PG&E. Thank you.
Thank you, Mr. Baker. We appreciate your comments. We'll try one more time for Ms. Sarah Bowe. I think your audio is not connected because I don't see a microphone that we can mute or unmute. So that might be our challenge, but we'll go ahead and try one more time to give you 2 minutes to share your comment. Ms. Bowe? Okay, I apologize, but we're going to have to move forward with the agenda. And we thank everybody for their public comments. At this point, we're going to go ahead and kick off item 8, which is a briefing and an update on COVID-19, including impacts, action, proposals, and plans to address COVID-19.
Thank you, Chair Lopez and board members. We have 4 items we'd like to update you and the public on today regarding the county's response to the COVID-19 emergency. The first item is a testing update, and we have, I see on the screen here, Elsa Jimenez, Dr. Moreno, and Christy Michi from Dr. Moreno's staff. So I'll turn it over to them, and then we have 3 other items after that.
I'd like to make one quick comment before we do that. I'll just share with the public. I'm going to take all these presentations on this item together,
Okay.
And then we'll take one public comment portion at the end of the presentation.
Okay, would you like me to list what the other presentations are at this point?
No, it's okay. We can take them as they come. Thank you.
Elsa, do you want me to start?
No, Dr. Moreno, go ahead.
Okay, and Christy, are you on? I see you, okay. All right, good morning, supervisors. So testing remains a critical tool in combating a pandemic, and we rely on testing to tell us who is infectious and who needs to be isolated, and which close contacts need to be in quarantine to slow down the spread. Testing also gives us an idea of the amount of activity in the county, which helps inform us in making changes to restrictions in the movement of people and the activities that we're committing. we have been able to increase the amount of testing capacity in Monterey County by in a variety of ways. Our hospitals now all have equipment and can test patients at their facilities for COVID-19. We are very happy for that. There's a quicker, and I know Dr. Gray's there, so I'll keep it brief. We're very happy that they have the testing, and our public health lab continues to work with the hospitals. The hospitals are interested in knowing how reliable their new test is different than our test. Our test takes 3 hours, about 3 hours to run, and is supposed to have a higher sensitivity. The tests at the hospitals take minutes to run. And so they have, from time to time, we're receiving some samples from the hospitals that were tested negative, and we're running them to verify whether they're true negatives or whether they missed a positive. So we're working closely with the hospitals to assess the new equipment and new testing supplies that are in. And the other big news is that we've been talking about Optum. And Optum is OptumServe is a company that is providing testing services here in Monterey County on behalf of the state. So we have scheduled to have 2 sites here in Monterey County. We really want to make sure that we make good use of these testing facilities in Monterey County and really encourage our healthcare facilities and our first responding agencies to encourage their employees to sign up either through the website or by calling to get an appointment to get tested. Those sites do not require someone to test them. They don't need symptoms, and they can just get tested. So once we have hope to get many first responders and healthcare workers tested, we want to, as soon as possible, open it up to other employees of essential services in Monterey County and the general public as well. And our public health laboratory continues to provide testing. We can still do 80 tests, 80 people per day. We can ramp up if there's an outbreak, and we've had some outbreaks, to 120 tests per day. So with that, I'm going to, if you don't mind, pass it over to Christy Mishi, who can talk a little bit about how the tables that are publicly available on our website on confirmed cases has been updated. Christy?
Morning. So on our public website, we have been daily updating the numbers of people who have been diagnosed in Monterey County with COVID-19. We look at that data by certain demographic characteristics that help us not only determine where people are getting sick in Monterey County, but which populations may be disproportionately affected. And that helps us and our community partners be able to guide outreach and education efforts to those areas of the county who may need it the most. We collect that information from the reports we receive, both from medical providers in Monterey County and from the laboratories who are testing patients. We've also provided information about how people are getting sick in Monterey County. Are they getting it from their household members, or are they acquiring it from the general community, or are they being exposed while traveling? So that information is available and updated, as well as information about what kind of risk factors people who are becoming sick may have. Do they have underlying medical conditions that predispose them to certain to complications of COVID-19? Also on the website, we've been providing information about the number of people in Monterey County who are what we consider recovered. And in Monterey County here, we are defining recovery as release from isolation. So we're very pleased that the number of people who are recovering from COVID-19 is increasing as we move forward in time.
Okay.
Thank you, Christy.
Was there any additional comments, Dr. Moreno, or was that the end of that portion of the presentation?
No, I believe that covers the testing portion, Supervisor.
Okay. So at this point, I will open it up for board members. Is there any questions or comments on this portion of the presentation from the board?
Mr.
Supervisor Alejo, I saw your mute was taken off. Yep.
Yes, I wanted to follow up. Along with testing, we're able to identify COVID positive patients and residents in our county. But I don't, could you elaborate more just on the contact tracing? Once people are treated or they're quarantined, how is the county following up on contact tracing, and how much staff do we have to be able to do that effectively? I know I've been watching other counties staffing up and getting more help so that that's done more expeditiously and more effectively. But I don't have if you could give us a better sense of how we're doing on that in Monterey County.
Well, sure. And also, would you like me to take this one? Okay, I'll go ahead and start. So thank you, Supervisor. So our case investigation and contact tracing uses the same principles and many of the same protocols that we've been using for years to do case investigations and contact tracing in Monterey County for other diseases like measles, for example, or tuberculosis. The difference is that we've had to make some modifications to our existing protocols, of course, and this is a pandemic, so there's some uncertainty, still some uncertainty as to how bad this could get in California and Monterey County. So those are some main differences. So in using those techniques, in California, all laboratories are required to report all COVID test results to the health officer. My staff receive those, and they're entered into the state's electronic disease reporting investigation system. So we get the information and we contact the person who is confirmed as a case through testing, and we then request much of the personal demographic data that you've seen on our website directly from the individual. And sometimes we might have to go to a medical record to identify some of that information if it's necessary to complete the demographic information. And we talk to the individual to find out the circumstances, in particular, when their symptoms first started, how long they've been sick, and what's their current status. Are they the same, still sick, or are they improving? And based on that, we can begin to estimate how their infectious period. Once we decide on their infectious period, then we work with the person to determine who they had close contact with during the infectious period. And we assemble that list, and we have contact tracers who begin the process of contacting everyone that the individual identified. If an individual with COVID-19 has been employed during their infectious period, then we may need to call the employer, and we've done that many times, and call the employer and work with them so that they can help us by looking through their schedules of shifts for their employees, and to see who was near the person that was infectious, and who would meet criteria for close contact. And we add those employees to our list, and continue the process. So I think so that's what we're doing. I'd like to pass it over to Christy, because Christy, I believe, might have some more details as to numbers of contacts that we've identified, and perhaps the percentage of contacts that we've successfully contacted and put to quarantine.
And also, Dr. Moreno and Christy, if you could answer, have we hired more staff to help with this? Do we have adequate staff? If you could answer that in your response.
Good morning. So yes, The answer is yes, we have hired more staff. We are, of course, training more staff to prepare for any increases in number of cases that we might receive with the new testing coming up. Well, our normal case and contact tracing staff is 3 for communicable diseases. Currently, right now, we have 20 trained case and contact investigators. We have another 10 who are training this week. So by the end of the week, we expect our team to be 10 times what it normally is. We have a ratio right now of about 1 case in contact, 1 case manager or 1 person for every 6 cases. The state recommends no more than 1 to 10. So we're doing, we have not reached the maximum recommendation from the state level yet, but we continue to watch those numbers as we move forward and prepare for the time when we may not have adequate case numbers. Right now, as of the 3rd, we had elicited over 1,300 contacts. That's about an average of 6 contacts per case. And we've been really quite successful at reaching those contacts. Right now, our percent of contacts that we've been able to reach is 98% of the contacts that we've elicited, we've been able to reach. So these teams are really aggressive and dialed into the community and working hard to make sure that we identify individuals and get them into isolation as soon as possible.
Thank you, Christy. I'd just like to add that the state of California has issued a program that is going to provide statewide uniform testing for case investigators and contact tracers. So that's going to be a tremendous plus to us as we bring on, as Christy mentioned, when we bring on 10 people, we have to pull someone to train that individual. Training is critical. Proper training and oversight of new people on this assignment is very important. So when the state rolls out their training, we can have our current staff continue to do investigation and tracing while the new staff receive the training from the state. So that's going to be a big plus. In addition, the state is looking at how it might also actually reassign employees from, I believe, the California Department of Public Health to actually reassign them to help with the investigation, the tracings here in our counties. So that will also expand our local capacity to meet what will likely be an increase in numbers of cases, because we're also significantly increasing our testing capacity with the OptumServe services that are coming in. So as we test more people, we're going to find more people, and if they're infectious, we need to do whatever we can to contact all of those as well.
Thank you, Dr. Moreno and Christy. I thought that was an important piece for the public to hear because it's critical to flattening the curve when we identify patients, to be able to do the research to find out who are all those people they came in close contact with, and to be able to alert those and quarantine those folks if they've been exposed. But also that we're also taking this very seriously by hiring more staff, training the staff, and having the adequate number, if even under the state standard, over the state standard, to be able to do this critical piece of fighting this virus in Monterey County. So I appreciate your efforts, but it was just important for the public to hear more on these efforts. Thank you.
Thank you, Supervisor Alejo. I see Supervisor Parker has her hand raised.
Thank you, Mr. Chair. Just a little detail, Dr. Moreno or Christy Michi, can you tell us when in the testing process, when you get a positive result, is it tallied on the matrix that is on your website on the day that you receive the result from the test? Or how does that work? When does it actually get logged as a positive case?
Christy?
Because we're receiving positives all throughout the day, what we do is we continue to receive positives up until midnight, and then all of those from that day are reported on the website the next business day. Or actually the next day. We've been reporting every 7 days a week.
Thank you.
Any other questions from board members? Seeing no hands going up, Mr. Chulos.
The next update is on our care and shelter plan. There are 3 components we'd like to update you and the public on today. The first is the status of alternate housing sites, and Gary Millay, our OES manager, and Mike Durr, our contracts purchasing manager, are going to speak to that. And then Gary is going to update on the Project Room Key program and the trailer situation.
Great. Mr. Millay?
Yeah, good morning. Can you hear me?
We got you.
Okay, great. I heard my echo, so that's all good. If I could be indulged, I'm going to combine the Project Room Key and the alternate housing report because they are so interconnected. As we know, the Project Room Key is a state program that encourages the county to utilize hotels and trailers to isolate and shelter its homeless population that are COVID positive. We in the Monterey County are doing that. We are utilizing hotels at this time. We have trailers available, although no COVID positive patients are in those at the present time. Because of the uniqueness of Monterey County, we've taken it a step farther and combined a 3-pronged approach to where we utilize hotels, we utilize trailers, and we also utilize alternate housing sites. Currently, we have one site at the Monterey County Fairgrounds that is operational, and we have another site at the Sherwood Hall in the Salinas that we are signing the agreement today, and that will be operational in approximately 7 days. So that is our approach to keeping the public safe by sheltering and isolating people that are COVID positive, and also our cohort of population that are high-risk homeless people that are non-COVID, but would be seriously in jeopardy of death if they were to contract COVID because of their age and pre-existing health concerns. Currently, in our alternate housing program, the Monterey County Fairgrounds is operational but has no guests, and the trailers at San Lorenzo Park is also operational and has no guests. We have approximately 70 guests at the hotel that we're utilizing in Marina, and we are securing a vacancy at other hotels around the county, which is somewhat challenging because now they are starting to become occupied with other paying customers. But that's still a process that we're taking on, and we are finding some success and providing all of the wraparound services, which would include security, feeding the people, providing medical care, and site management that would be involved. That would be the end of that report. If there's any questions.
Let's keep going, and we'll do questions on yours and Mike's presentation together. Thank you. Unless that was it.
He pretty much covered it.
Okay, thank you very much. Questions from board members? I see Supervisor Parker has her hand up.
Quick question, Mr. Millay. Of the 70 people who are in motel rooms, how many of those are the at-risk vulnerable, and how many are COVID positive?
The large majority at the present time are the at-risk population. Not only what we call in our county as whole person care, but also the coalition, we've partnered with them and the clientele that they are responsible for. So yes, the majority of those are the high-risk, at-risk population. COVID positive at the present time are only 3.
Thank you.
Any other questions from board members at this point? All right, back to you, Mr. Chulos.
And I believe Mr. Millay is going to speak briefly about the trailer availability situation.
Yeah, thank you, Nick. So in addition, I mentioned that trailers were part of our strategy for alternate housing. This has been somewhat unpredictable at this point. We, as you all know, we were originally requested and informed that we were going to get 100 trailers from the state. That subsequently was changed to 15. There's some confusion because we were told that was just our first allotment. We actually were informed recently by the state that it was actually our entire allotment, that if the county wanted additional trailers, the state would lease some for us, or we were able to lease them ourselves. So there will be no more trailers coming from the state as far as that program that they initially started with our request for 100. At the current time, that all the trailers that we have that are ready for occupation are down in San Lorenzo Park. And that is, the southern end of the county's part of our strategy for alternate housing. I will say that in addition to what I just reported, we are working very closely and in partnership with our agricultural community, with all of the different ag businesses as the representative of the growers shippers. And we are assisting with any of the isolation and sheltering of COVID positive agricultural workers. Currently, we have 24 of the agricultural workers that tested positive that are being sheltered and isolated. That is being done in hotel rooms. The grower shippers are responsible for those patients at the present time, and the county is assisting by providing some of the wraparound services that are needed to do that. As that number increases, the county involvement will also increase to the point where then we will also begin to isolate and house those COVID positive patients ourselves, utilizing not only the trailers, but hotels and our alternate housing sites that we are planning in the Salinas area and in future planning if the need arises at the Salinas Valley Fairgrounds.
Thank you, Mr. Millay. Any questions from board members? Seeing no hands going up, I've got a couple quick ones for you. You did just say that all of our trailers are now in South County. Does that mean that the ones that were initially stationed in Marina have moved south?
No, the 5 trailers that are at the Marina Airport are still staged there, but any of the trailers that we have available for occupancy are in South County at San Lorenzo Park.
Okay, because it sounded like all of them had been moved south. The other question is the list of who got trailers from the state. I know we had requested that request be made. Was there ever follow-up on that or a response given?
That request was made. We have not received a response yet.
Okay, thank you very much. Seeing no other board members' hands going up, I'm going to go back to Mr. Chulos.
And actually, Mr. Chairman, Mr. Millay covered a little bit of the next item in terms of the agricultural worker situation. There's a lot of concern about the potential spread of COVID in the agricultural worker community, and Christy Michi is going to speak a little bit about that from her standpoint. Mr. Millay already addressed the housing efforts that we're working on. Thank you.
So we are working very closely, as Gary mentioned, with the hospitals and the agricultural community, the Ag Commissioner, to try to make sure that our essential workers in the agricultural industry have information about what they can do to protect themselves. We are working with the EOC to, as we do our case and contact investigations, to identify individuals who may not be able to appropriately isolate themselves in their current living environment. So we can try to move those individuals out temporarily while they're infectious to try to reduce the spread of COVID-19 within their home environment while they're recuperating. We do think that this will not be a unique situation to the agricultural industry as we open up other industries and allow other groups of people to go to work. We are planning to try to continue this process with other industry sectors as we move forward, knowing that as construction workers go back to work and other groups, that we will likely see a similar situation where there is an increased amount of exposure among workers.
Thank you, Christy. Any board members have comments or questions on that report? Seeing no hands, we'll go back to you, Mr. Chulos.
Thank you, Mr. Chairman. The last item this morning, we wanted to speak a little bit about the food programs that are becoming available. Unfortunately, both Lori Medina, our Social Services Director, and Chris Donnelly, our Workforce Development Board Director, were not available today. Actually, Chris is out ill. They're both working on the logistics of how this program will actually be operated, but we wanted the public to be aware that, and the board to be aware that there is funding for providing meals to seniors. The general outline of the program, one of the ideas is that it would utilize existing restaurant capability, and Mr. Donnelly is involved because he would help bring some of the laid-off restaurant workers back in to actually work in the restaurants and prepare the meals and distribute them. How all that will be worked out, I don't have any detail on today. We're working on it. I know it's a work in progress, and those two are working together to put the program together, and we can report further to you as soon as we have information on that.
Thank you. Comments or questions? Seeing none, that's the end of our presentations for today. So now we'll open it up to the public for public comment on this presentation. I'm going to first see if there's anybody in the room. I see Mr. Peterson coming forward, so we'll give you your 2 minutes first.
First, I think the numbers compliment the county employees on how good a job is being done. If you compare Monterey County numbers with other jurisdictions, we're really low, and that says a lot of good things for what's being done here. I do have a question, and that has to do with outreach to mentally ill homeless. I was wondering what's being done to reach the people in the bushes who may not comprehend that there's even a crisis, or may not fully comprehend what the crisis is like and what they may need to do. And we've got people in the bushes, in all sorts of places, on park benches, things like that. And a lot of them do not have the same faculties as most of us. Thank you.
Thank you, Mr. Peterson. Anybody else in chambers? Seeing nobody coming forward, I see Gary's PC has their hand raised. So Gary, we're going to go ahead and unmute you and give you 2 minutes to share your public comment via Zoom.
Chair of Government Affairs for the Monterey County Hospitality Association. Am I coming through to you?
You are.
Great. Board members and Mr. Chair, thank you for the ability to be able to make some comments this morning. I wanted to just kind of get you up to speed where the Monterey County Hospitality Association is and where they started. On April 2nd, MCHA created a special COVID-19 advocacy subcommittee because we felt that was the best way to communicate with electeds, our members, and our members' employees. This committee is working diligently on creating a re-entry plan. About a little over 2 weeks ago, our committee chairs met with Supervisor Lopez and Supervisor Adams to explain to them what our ideas were and how we were putting them together, and that we would be returning to the board with a firm plan. I know this has taken longer than some of you thought it would, but you have to appreciate when we're talking about major hotels reopening, this is much more complicated than opening a grab-and-go restaurant. So we are close to having this document ready to send to you, and then once that is approved, go to Dr. Marino with it. We are very fortunate that Dr. Jerry Taplin has joined our group and is signing off on all of our protocols. Again, this is a very complicated process, and we're coming close to a point where we're going to be able to combine all of the proposals that are out there, including restaurants, the racetrack, all of our hospitality members. And we're, again, very, very close to having that ready to present to you. So have a little more patience. Once the plan is in place, there is no one better positioned than the Monterey County Hospitality Association to put the plan in play. Remember, keep in mind, if you will, these are our members' employees. These people work for our members, and therefore we have access to them, and we'll be able to put this program forward. Again, have a little patience, and thank you for your time.
We appreciate your comments. All right, I'm going to go back to the Zoom, and I see no more hands raised. So I'm going to go ahead and close public comment on this item and bring it back.
I know that Kim Stembler was wanting to ask a question.
Oh, there goes her hand. Ms. Stembler, we'll go ahead and unmute you now.
Thank you, Supervisor Alejo. First, I just want to send my personal appreciation for Dr. Moreno and your staff. You are superheroes. I'm amazed that I don't imagine that you sleep or eat at all. And we're just all so appreciative of the work you're doing. And my question is, as we both loosen restrictions and we increase testings, is there an anticipated acceptable percentage of increase, a rate of increase that you anticipate? And what I'm looking for is we're going to see a bump up. And my hope is that we don't have another contraction as we're loosening, if it is a predictable bump. That's it.
Thank you, Ms. Stembler. Any other public comments at this point? Seeing no additional hands up, bring it back to this board and see if there's any additional comments. Supervisor Alejo, I saw you unmuted.
I just wanted to see if Dr. Moreno had any response to Ms. Stembler's question.
Sure, Supervisor.
Or Mr. Peterson's.
Why don't I start with the last one? So yes, as the chair mentioned, we just this weekend released some restrictions in Monterey County, which means more people are going to be leaving their homes, and so as more people leave their homes, that increases the opportunities for the virus to be transmitted and people to get exposed. So we might see some increase. Fortunately, though, our hospital census, has been stable now, and that's really, I believe, a very good sign that the social distancing and sheltering in place is doing what it's supposed to, slowing down the spread. So as we release, more people might get exposed, so we might see an increase. And also and we'll monitor that. We'll also have more cases because we're expanding our testing capacity in Monterey County, which means more people will be tested that don't have symptoms. And we're going to see some positives there as well. So our number is going to go up, but we anticipate I anticipate that, and we have our epidemiologists who are going to look at ways to analyze those changes in reported cases and make some sense as to what is our baseline and what is due to just increased testing. Thanks.
And I don't see Lori Medina on, but perhaps Dr. Moreno or Elsa, could you speak a little to the question that Mr. Peterson raised about how we're outreaching to the mentally ill, perhaps living homeless on the street and that might need assistance?
Good morning. Sure, I can help address Mr. Peterson's question. I know that through our behavioral health system of care, we are in constant communication with individuals that are connected to our behavioral health system of care. Through our Coalition of Homeless Service Providers, many of those organizations are also in contact with individuals under their care or through general outreach efforts with respect to COVID-19 and what to do. You may recall that the Coalition of Homeless Service Providers, the City of Salinas, and others were keen at the inception of our response efforts to put out hand sanitation and restroom facilities at homeless encampments to make sure that individuals had access to basic preventative care. And more recently, as was discussed earlier through the shelter and care update, we've been working through the Coalition of Homeless Service Providers, Behavioral Health System of Care, Department of Social Services, and our Whole Person Care program in identifying individuals that are connected to those systems who are at higher risk of developing complications if they were to become COVID-19 positive, and have taken steps to secure those individuals and move them into more stable housing while hoping to help prevent their exposure to COVID-19. And these efforts are ongoing and will continue to identify other individuals meeting that higher risk criteria to try to make sure that we are able to provide them safe housing. So I hope that answers Mr. Peters' question. If not, he can reach out directly to me and I can point him in other directions.
Thank you, Ms. Jimenez. We greatly appreciate it. Supervisor Parker, I see your hand is up.
Thank you, Mr. Chair. Just a quick comment, no need to respond at this point, but we have been contacted by a number of people who would like to, as the next considerations of businesses to open or functions to be allowed, the whole issue of pet grooming. If pets are dropped off, you know, all the protocols that vets are following for you know, the precautions. For many pets and owners, it's a health and safety issue. The pet needs grooming and the person is not able to do that themselves. So I'll submit this to the staff person who keeps track of these kinds of things and to make sure that it gets considered in the next round. Thanks.
Thank you, Supervisor Parker. Any additional comments from board members? Seeing no hands going up, we will consider this report received. Thank you so much, Mr. Chulos and team, for all your diligent work. And we're going to go ahead and head into our next item, which is a presentation, the annual report from the past chair, Deneen Gus, Monterey County Superintendent of Schools, on the county's Children's Council.
Good morning.
Good
Let
morning.
me and share my screen and we'll get started. One more moment here. There we go. Well, again, good morning. As mentioned, I am Dr. Deneen Gus, Monterey County Superintendent of Schools and the past chair of Children's Council. It's a pleasure to be here today to present an overview of the 2018-19 annual report. Before I dive into today's presentation, though, I'd like to take a moment to acknowledge those who've lost a family member or friend during this health emergency, and also to thank the Board of Supervisors for your strong leadership and give you a special shout out for the extraordinary leadership that you've shown during this health emergency. And one last word of thanks and gratitude to the Health Department for their tireless work in responding to all of the many challenges that our county is facing right now. And with that said, I will jump right into the presentation. It's a fairly long presentation, so please bear with me, and I'll open it up for questions at the end of the presentation. So the purpose of this presentation is to, one, bridge the gaps between the organizations who are doing work on behalf of the residents of our county and the Board of Supervisors. Two, offer an opportunity to advise and inform the Board of Supervisors. Three, to provide a chance for the Board of Supervisors to provide direction to the organizations. And four, to increase the transparency and accountability of county government. This report will provide organizations an opportunity for self-reflection, celebration of accomplishments, and information for future planning. So, why does the Children's Council have an annual report? The Children's Council annual report was created to help our community understand the needs of our children and youth. And the annual report has 4 goals. 1, to provide a benchmark on how children and youth are faring in our county. 2, to mobilize community-wide efforts to address the most critical challenges to children and youth. 3, to recognize success in improving children and youth's quality of life. And 4, to present multiple indicators in a simple arrangement and location. So, what has changed in the annual report this year? There are now 28 indicators, half of which are new. In addition, indicators are organized into 3 age ranges: birth to 18, birth to 5, and 6 to 18. In the summary highlights, indicators for children and youth are assessed as stable, fluctuating, increasing, decreasing, or not available for Monterey County and the state of California. So let's go ahead and jump right into those indicators. For the birth to 18 category, we see the number of children supported by CalWORKs decreasing, while the percentage of children with health insurance is increasing. We also see increases in students with free and reduced price meals and students experiencing homelessness. As a reminder, these data are representing previous years. We expect that the COVID-19 and possible economic effects may change any of the trends presented here in future years. Please note that there are a few trends that are being revised in the written report, and this version of the presentation has those revisions integrated already. So it may vary slightly from the materials sent last week. Here you'll notice that children in foster care are now noted as fluctuating. In regard to age 6 to 18, you see here, low birth weight has been corrected to stable, and highlights from birth outcomes show increasing rates of early prenatal care and mother's education. The availability of childcare slots and costs are now fluctuating, and kindergarten readiness is increasing. Public school enrollment has shown increases, as well as students enrolled in special education. For the 6 to 18-year-olds, we're seeing increasing English language arts and math scores, as well as dropout rates and sexually transmitted infection cases. Physical fitness scores are decreasing, as well as student suspension rates over time, expulsion rates over time, births to teen mothers, and juvenile misdemeanor and felony arrests. English learner results, childhood obesity, graduation results, and college-going rates are fluctuating. In regard to children living below the poverty level, CalWORKs provides financial assistance to needy children and families in Monterey County. Over the last 5 years, we've seen a consistent decrease in the number of children supported by CalWORKs, whereas the total population of children in the county has increased slightly. There are approximately 2/3 the number of children supported in 2018-19 as in 2014-15. Looking at children with health insurance, the percentage of children living below the poverty line has consistently been lower in Monterey County than California and closely parallels California's trend line. For reference, based on 2018 federal poverty guidelines, the federal poverty line for a family of 3 was having an annual income of $14,150 or less. Looking at child abuse and neglect, the number of children without health insurance has been dropping every year. Oh, I'm so sorry. Looking at children with health insurance, the number of children without health insurance has been dropping every year. Children with health insurance are more likely to receive preventative care and immunizations that will aid in decreasing the likelihood of illness and reduce out-of-pocket medical expenses. Generally, children with health insurance will experience better overall health throughout their childhood and into their teenage years. Now we'll look at child abuse and neglect. Allegation and substantiation rates for a given year are computed by dividing the unduplicated count of children with a child maltreatment allegation or substantiation by the child population and then multiplying by 1,000. Monterey County's rate is still below the California rate, while the difference between the two is narrower now than it's been in the past 5 years. Monterey County's rate of children entering foster care has been below the state's for the past 5 years. And of course, best practice in both federal and state laws discourage the removal of children from their homes unless absolutely necessary to ensure the child's safety. The placement of children in out-of-home care is an indicator of family problems that are so difficult that a child cannot remain with his or her family. The number of children enrolled in the free and reduced meal price program has continued to increase over the past 5 years while stabilizing for the past year. As an aside, districts and schools have done a wonderful job of contributing and continuing to provide meals to students during this time of physical school closure. They are literally serving thousands of meals to students in need every single week. When looking at student homelessness, you see that the number of students experiencing homelessness has risen substantially since 2014-15. For the purpose of this indicator, homeless students are individuals who lack a fixed, regular, and adequate nighttime residence. This includes children and youth who are sharing housing due to loss of housing or economic hardship, as well as more commonly recognized forms of homelessness, such as living in a vehicle or motel. Moving on to birth weight, prenatal care, and mother's education. We've seen great improvement over the last 5 years in the percentage of pregnant women who receive prenatal screening and treatment for medical conditions and identification of behavioral risk factors in the first 3 months of pregnancy. There is a somewhat larger percentage of mothers who have a high school diploma or equivalency, and the percentage of low birth weight babies has held constant. Looking at child care slots available, the total number of licensed child care spaces has remained fairly constant, while there is a shift from the number of licensed family child care spaces to licensed center-based spaces. Moving to childcare costs. The cost of childcare in Monterey County has increased for infants and preschool-aged children at family childcare homes, whereas center-based care has only increased for preschool-aged children and not for infant care. Looking at kindergarten readiness, understanding a child's readiness to begin kindergarten can be the difference in a strong start to a student's success in school. A strong start in school can promote social and academic growth. And just a side note here, in the past, assessments were completed every 3 years in order to reevaluate the effectiveness of the tools used in the assessment process. A community review process was conducted, pushing the schedule for school year 2020-2021 to allow time for that review process to take place. Moving on to public school enrollment. Total enrollment in public schools in Monterey County has increased slightly over the past 5 years, with just a slight dip in 2018-19. Enrollment in special education has continued to increase at a rate faster than the increase in total enrollment. Special education enrollment is a key component in addressing the needs of all students and being able to deliver an enriching learning experience. Categories of enrollment in special education can include autism, intellectual disabilities, speech or language impairment, or visual impairment, among others. Looking at academic achievement, we'll start with reading CASP scores. One way student progress is measured is through computer-based assessments for grades 3rd through 8th and 11th. Here we see the scores for English language arts. Because the California Assessment of Student Performance and Progress, also known as CASP, because these tests are given statewide, they provide an opportunity to measure the skills of all students against the same academic standards. Monterey County has grown slightly over the past 3 years, while we're still below statewide levels. And please note that this year there will be no CASP testing due to the COVID-19 health emergency. In regard to English learners are those students for whom, one, parents report of a primary language is other than English, or two, students who lack English language skills based on the state English Learner Progress Assessment that's administered to students when first entering public schools and annually thereafter. English learner students are reclassified according to multiple criteria, including assessment results and district adopted standards that demonstrate that students have an English language proficiency comparable to that of average native English speakers. The number of English learner students has decreased slightly in recent years, while at the same time, there's been an increase in the number of students who have been reclassified as fluent in English. Looking at math CASP scores. As we mentioned, for English language arts, the math one-way student progress is measured is through computer-based assessments for grades 3 through 8 and 11. Because the CASP tests are given statewide, again, they provide an opportunity to measure the skills of all students against the same academic standards. Monterey County has grown slightly over the past 3 years, while we are still below the statewide levels. In regard to childhood obesity, nearly half of the students measured were not in the healthy fitness zone for body composition. Overweight and obese children are at a higher risk for the emergence of multiple illnesses as they age into adulthood, including heart disease, hypertension, diabetes, respiratory diseases, and bone and joint problems. Physical fitness. The assessment used to assess physical fitness is called the FitnessGram. The FitnessGram is composed of 6 fitness areas, including aerobic capacity, abdominal strength and endurance, upper body strength and endurance, body composition, trunk extensor strength, and flexibility. The percentage of students who meet the healthy zone on 4 or more of the 6 tests has decreased over time in Monterey and in California. The higher the grade level, the more likely the student is to meet at least 4 of the tests. In other words, a higher percentage of 9th graders meet more than 4 than the 5th graders. Monterey County's 5th and 7th graders are below the state, whereas our 9th graders are similar to statewide results. The 4-year adjusted cohort graduation rate that you see here on this slide is the number of students who graduate from high school in 4 years with a regular high school diploma divided by the number of students who form the adjusted cohort for the graduating class. The 4-year cohort is based on the number of students who enter grade 9 for the first time. This rate does not include a general equivalency diploma, also known as a GED, a certificate of completion, certificate of attendance, or any other similar or lesser credential, such as a diploma based on meeting individualized education program goals. It also does not include students that graduate in their 5th year. We do see disparities in graduation rates. For example, a higher percentage of female students than male students graduate with a regular diploma within 4 years. In addition to gender, we see differences in other socially constructed categories, such as race and ethnicity, where we see Filipino students graduating at the highest rates and African American students graduating at the lowest rates. Some of the students who the schools are most struggling to meet their needs for graduation are students with disabilities and students who are foster youth. The suspension rate indicator is based on the number of students who were suspended at least 1 full day. The suspension rate is calculated by dividing the number of students suspended by the cumulative enrollment. Monterey and California have decreased the percentage of students who are suspended since 7 years ago, but we are slightly above the state rate. Offenses that students may be expelled for include violent incidents, weapons possession, controlled substances, and defiance. Like suspensions, Monterey and California have decreased the rates of students who are expelled since 7 years ago, and Monterey County is below the state rate. Please also note that the total number of expulsions is very small, only 39 in 2018-19 out of the nearly 80,000 students in the county. This graph looks at the rate of the demographic subgroups. It appears that foster youth have a much higher rate of expulsion, but please note that because these are very small numbers, this represents only 2 students. Also, please note that this graph has been revised from the previously included version. As we mentioned on the graduation slide, this is based on the 4-year cohort of the number of students who enter grade 9 for the first time. Monterey County's rate has been increasing over 3 years. Concerning safe sexual behavior for teenagers, the teen birth rate has continued to decline over the past 5 years. However, rates for sexually transmitted infections such as chlamydia and gonorrhea have increased. During the past 5 years, there have been slight decreases in the number of juvenile referrals. One factor to consider is changes in California legislation regarding juvenile justice over the past few years. Juvenile Justice Realignment, SB 81, passed in 2007, helped transform the juvenile justice system in California. This has led to significant increases in probation using evidence-based practices and a reduction in juvenile arrest rates. More recently, another California law passed in September 2018, SB 439, which established 12 years as the minimum age for prosecution in juvenile court unless the offense is murder or a specific sexual offense. This slide shows the Children's Council prior areas of focus. In 2018-19, the Council continued to focus on Bright Beginnings and also received a series of presentations exploring the issues of homelessness and lack of affordable housing, homeless services available for school-aged children and youth, immigration policies and their impact on children and families, and lastly, the emerging mental health needs of the students and families we all serve. On March 17th, just before the shelter-in-place mandate was rolled out, you received a full presentation on the Bright Beginnings Early Childhood Development Initiative. Since then, the Bright Beginnings backbone has become one of the key players in the emergency response and recovery effort to support early childcare in the county. In addition to business as usual, the backbone team has stepped up to coordinate the response to support essential workers that need safe, reliable childcare. The response and recovery effort also aims to inform and protect childcare and education providers, who they themselves are top priority essential workers in high-risk jobs. As we do our best as a community of educators to provide continuity of care and education for all ages, we need to remember that this pandemic is a traumatic event that can deeply affect all, but especially our youngest. The Children's Council is looking to increase our capacity to provide trauma-informed care, education and services for all ages, with Bright Beginnings taking the lead for early learners. We also know that safe, quality childcare is important in our economic recovery. And we encourage you to include early childhood development needs in all of your post-COVID planning efforts. This concludes my presentation, but I do want to acknowledge our current chair, Elsa Jimenez, for her great leadership, and also give a shout out to Myra Perez-Diaz for the backbone support she provides to the council, and all of the Children's Council members for their dedication to the children and youth of Monterey County. And now I'll open it up for questions.
Thank you, Dr. Gus. Any questions from board members? I see a hand up from Supervisor Parker.
Thank you, Mr. Chair, and thanks, Dr. Gus, for this presentation. I just had two questions, and I don't know if you know the answers, but what do you know about the increase that we've seen over the last few years in child abuse and neglect cases? You know, what's going on in our community that's happening? And then the decrease in the home-based childcare. What's going on with that? Those are both kind of disturbing directions. Thanks.
Thank you, Supervisor Parker, for those questions. Unfortunately, I do not have the answers to those, but I know that Elsa is on the line. So I'm going to ask Elsa if she could respond to those questions. Elsa?
Thank you for the question. Unfortunately, I don't have definitive responses. I could surmise what may be happening, but I think it would be best if I reached out to Lori Medina, as that data element comes from her department, as well as Francine Rod and the Child Care Planning Council to get an accurate response for you, Supervisor Parker. So I'll get that to you via email.
Thank you.
Supervisor Adams.
Thank you. Thanks so much for your presentation, Dr. Gus. I have just a couple of questions, and I wanted to know if you can tell me what happened between 2014, 15, and 15, 16 that caused the really surprising, almost doubling spike in the number of students that were determined to be homeless in Monterey County. Was it like a change in the McKinney-Vento, how children were counted, or was there, you know, additional people that came on board to track this?
So that's a great question, and I'm going to turn that over to David Dabrowski, who's also here with me, and he is the person who's been gathering all the numbers. So give me just a moment to turn it over to David.
Thank you.
Hello, Supervisor Adams.
Hi.
So that increase, those numbers are derived, each school district or LEA has their own policies and how they collect and how they define homelessness within their district. And so the largest amount of those changes, some of it is change in students and their student body, but that's a policy decision at the LEA level that's influencing that for that big jump.
Okay. I have another numbers question.
Oh, before we move on, Supervisor Adams, just real quickly, I want to add to that just a couple of years ago, the Monterey County Office of Education also received a grant that allowed us to hire a homeless coordinator. And I do believe that once that homeless coordinator came on board and really began working with the liaisons and really sharing best practices around how you properly identify those who qualify for our McKinney-Vento program, that may very well have also led to some of the increases in identification. And so I'll move on to your next question.
Okay, and that is that I know that there is a real need for childcare in our communities. And I was just wondering if you, are we on any kind of a track to try to ensure that we're going to be able to provide enough childcare licenses to meet the number of slots that we actually need for the children, the 0 to 4 children in our county?
That question we are going to have to refer to Francine Rod and, or I should say our Child Care Planning Council. I do know that there has been a huge push over the last several years, really trying to work on how to become innovative in providing those additional slots. There's been, we call the session, well, the Quality Matters team has come on board as well. But what I was trying to get at here is that the Bright Beginnings team, the Child Care Planning Council, the First Five, United Way, all of the various players who work in that space have been working very hard to find additional locations where center-based programs could be opened. I should note, I know this was part of your question, but I do want to just mention that right now during our health emergency, What we are finding thus far is that most parents are not looking for the center-based type of childcare for the children. They're relying more on family, friends, and neighbors at this time, just because they feel like it's a little bit safer.
You know, since you brought up the current time, I'd like to ask you a question of just your impression. If you can just tell us anything about how we know that children are faring through this most unusual time regarding sheltering in place. Is there any you have any kind of pulse on that at all?
Yes. Yes, actually, we hold a weekly meeting with all of the district superintendents via Zoom, where we're checking in regularly to see how the students are faring, both in regard to whether or not they're engaging in their distance learning program.
Okay.
Also, how teachers are staying in contact with each and every student to ensure safety and that their social and emotional needs are being met at this time. And so far, oh, excuse me, long presentation, I'm talking too long. So far, it looks like students are faring very, I am so sorry. Students are faring very well, but we do continue to check in on a regular basis.
Okay, okay. You better take care of that. Thank you.
Supervisor Alejo?
Yes, thank you. Superintendent, thank you for your presentation on Elsa Jimenez and the whole team for this report. I think for the public and for a lot of community members, this is probably one of the more important report cards we get on how we're doing in terms of providing services and gauging how our children are doing as they grow up in Monterey County. I like that quote that you ended with, that it's by Frederick Douglass, it's better to build strong children than to repair broken men, or and to modernize it, women, because as you pointed out, you know, we have a lot of work to do in certain areas: early childhood education, homeless children, and I do appreciate even your work during this crisis of trying to meet those technology gaps and trying to think outside the box by partnering with MST and trying to provide buses that could provide internet service for kids who are, if they don't have internet service, you know, they have no other way to be able to utilize their technology for classroom instruction or for their homework. So I appreciate those extra efforts that you're doing, bringing stakeholders together. But having previously worked in student discipline cases, I also want to point out how big of a change it is to see the expulsion and suspension rates go down. School board members and superintendents really looking at the research about how those decisions could really impact a child's life and increase the probability they're going to go into the schools to prisons pipeline. So to see your report card and how the numbers have dramatically been lowered, I mean, each of those kids, we're helping improve their life outcomes and opportunities by really taking a different approach, even when sometimes they make mistakes and get in trouble. So I really want to highlight how important that data is and how it really makes a difference in the lives of so many of our adolescent youth as they grow up. So thank you for the report, and I look forward to continue to see progress that we're making and hopefully keep making improvements.
Supervisor Phillips, any comments for us?
No questions. Thank you, Deneen. Like has been said, this is the most critical thing we got is the progress of our kids in the community. So we thank you for your report. Good to see you again. I'll let you save your voice.
Dr. Gus, I want to say thank you as well. You know, talking about what the needs are in our kids' lives at this point, I think obviously since the data for this report was collected in pre-COVID, the real need now is access. I think we're going to have a new challenge coming out of this with those kids that don't have access to internet and to the tools that they need to stay up to date via the digital learning. And I want to commend you for jumping out in front of that, seeing that coming down the down the rail and jumping on that track to say, how do we get ahead of this as quickly as possible? I know that your group, and which I'm happy to participate on and proud to participate on, has some big news coming from some emails that have leaked to me. So I just want to thank you for those efforts, because I know it's not captured on these slides, but I do believe that these slides will be impacted by the access to internet, the access to technology, and the access to bridge that digital divide for our children. And so I want to thank you for being in front of that, even though it's not part of today's presentation and it's not in the slides. I do believe it'll affect that data in the next iteration. And so I just want to commend you and your staff. I know you've got an incredible team over there, and all that you guys are doing to make sure that our kids, even 0 to 5, have access to digital, and their digital needs is critical. So thank you.
Thank you so much. Just to wrap it up, I just wanted to mention that in regard to the technology needs of our students, initially when the distance learning requirement came on board, we had over, I want to say, 10,000 needs for devices, or 10,000 students who needed a device. We now have that down to 1,500, which is great news. We do still have over 10,000 students that lack connectivity. So obviously we're still working on that issue as well. But the Digital Divide Task Force is definitely moving along. We are identifying those short-term and long-term solutions. And I cannot wait to share the good news that you were referencing, but that will come out tomorrow. So look for good news on that front tomorrow. And with that, let me just say, that your schools are in good hands, hands that are washed for at least 20 seconds. Thanks so much.
Thank you, Dr. Gus. So before we go, I do want to open it up to the public and give them an opportunity to share any comments with us. So going to the chambers, seeing nobody coming forward, I'll quickly go to the Zoom and see if I have any raised hands. I see no hands going up, so I'm going to bring it back to this board, and we once again will thank you, Dr. Deneen Gus, for your presentation. We appreciate your work on behalf of all the children of Monterey County. Thank you. And so I don't believe we need an action to receive this report, Mr. Counsel.
No, Chair, but I would like, before we recess back into closed session, I would like to announce the one thing that was done in closed session.
Okay, so thank you, Deneen. We appreciate you. We'll go to County Counsel to share with us some info out of closed session.
Thank you very much, Honorable Chair, members of the board. In closed session today, the Board of Supervisors approved the tentative agreement with Unit S, the nurses, on the terms that were discussed previously, but that's all official now. Thank you.
Thank you. We're going to recess to closed session. We'll reconvene the Board of Supervisors at 1:30 here in this chambers. Thank you.